If you're living with a disability, struggling with low income, or simply exhausted from navigating systems that seem designed to push you away rather than help you, this guide is for you. I understand you've probably heard promises before. You've likely submitted countless applications that disappeared into the void, but what we're covering today is different. These are verified programs that have provided real assistance, ranging from hundreds to tens of thousands of dollars for things like medical equipment, home modifications, essential medications, and more. Before we begin, I'd genuinely love to hear from you. What's the one thing that would make your daily life more manageable right now? Understanding your needs helps us continue researching the resources that matter most to real people facing real challenges. I want to be upfront. The programs we'll discuss toward the end of this guide can provide grants exceeding $15,000 annually for certain conditions, but we'll cover several important resources along the way, so stay with me through this entire guide. Let's address something that affects millions but rarely gets discussed: dental emergencies and the inability to afford care. Dental pain doesn't just hurt, it prevents you from eating, sleeping, working, and living your life. Yet dental coverage remains one of the most significant gaps in healthcare assistance. There are volunteer-based dental programs where licensed dentists donate their expertise to provide comprehensive treatment at no cost to qualifying individuals. These programs typically serve people who are disabled, medically vulnerable, or elderly and have exhausted all other options for dental coverage. Recent data shows these networks have provided treatments valued at over $15 million annually. When you calculate the average assistance per person, many recipients receive between $3,000 and $5,000 worth of dental care, sometimes significantly more depending on complexity. First, you complete a detailed application explaining your health status, financial situation, and specific dental needs. The program reviews your submission against two primary criteria. You must have no viable way to pay for treatment, and you must either have a permanent disability, be over 65, or have a documented medical necessity for the dental work. These programs focus on restorative and emergency care, not cosmetic procedures. That means no teeth whitening, veneers for appearance, or elective work. Additionally, dental implants are typically excluded due to cost. The focus remains on procedures that relieve pain and restore function: extractions, dentures, crowns, bridges, root canals, and treatments that allow you to eat comfortably and maintain your health. Many areas have waiting lists, and most programs limit you to one episode of care in your lifetime. However, if you're in genuine need, the application is absolutely worth completing. The profound relief that comes from resolving dental pain cannot be overstated. It's transformative. These programs provide small miracles daily for people who thought they had nowhere else to turn. National disability advocacy organizations often have local chapters that administer microgrant programs. These grants are typically smaller, ranging from $100 to $2,000, but offer remarkable flexibility and can address the specific needs of their communities. The availability and structure of these programs vary dramatically by location, so let me illustrate with contrasting examples. One state's program offers grants from $100 to $1,500 specifically designed to support employment, independence, or housing stability. You can apply annually, and interestingly, you don't have to submit the application yourself. Family members, case managers, or support staff can apply on your behalf. The restrictions are reasonable. Funds cannot cover recurring monthly expenses like rent or utilities, entertainment, vehicles, furniture, gift cards, or subscriptions. Instead, the money must support genuine progress: medical devices, job training, professional equipment, work-appropriate clothing, assistive technology, or similar investments in your future. Applications typically open on the first of each month, so if you miss one cycle, another opportunity arrives quickly. Another state uses an entirely different model, funding their program through special needs trusts. When someone with a trust passes away, a portion of remaining funds is redirected to help other disabled individuals in the state. Their grant categories include accessibility modifications, up to $2,000 professional conferences or educational conventions, up to $1,000 final expense assistance, up to $1,500 higher education support, up to $1,500 legal expense coverage, up to $2,500. These grants target people without resources to cover these specific costs independently. While less flexible than some programs, they address critical, clearly defined needs. Visit the national organization's website, locate the Find Your Chapter feature, select your state, and investigate whether they offer microgrants. Most chapters with active programs provide straightforward online applications. Certain charitable organizations specialize in providing essential items and services that insurance companies routinely deny or that Medicaid won't cover. These programs step in where traditional support systems fail. The range of assistance is remarkably practical. Wheelchairs, walkers, mobility scooters, orthotic devices, prosthetics, hearing aids, prescription eyeglasses, dentures, compression garments, and other medically necessary equipment that doctors prescribe but insurance disputes. They also fund small home accessibility improvements, ramps, stair lifts, bathroom modifications, and in some cases provide clothing, food, or essential household items when circumstances demand it. This is the everyday practical support that genuinely changes quality of life. Here's what's different. You cannot self-apply to these programs. They only accept applications from referring professionals, social workers, case managers, healthcare providers, therapists, school counselors, clergy, or anyone working in a supportive professional capacity. Your referring professional completes the application, explains your specific needs, and attaches relevant documentation or cost estimates. The organization reviews everything and determines if they can provide assistance. Most programs serve households earning below 300% of the federal poverty level. For perspective, that's approximately $45,000 annually for an individual or $96,000 for a family of 4. Additional requirements typically include stable housing for at least 3 months and, in many cases, being substance-free for a minimum of 1 year. Some organizations offer expanded services in their home state beyond what's available nationally. This might include assistance for needs exceeding $500, one-time emergency help with food or clothing, specialized programs for employed single parents, or support for transplant patients. If you live in the organization's home state, investigate whether additional programs exist beyond their national offerings. To access these programs, your referring professional should visit the organization's website and select either national or state-specific assistance, depending on your situation and location. Quick survey. If you're comfortable sharing, which state are you in? Many local and regional programs offer similar services, and knowing where our audience is located helps us focus research on the most relevant resources for your community. There's a widespread belief that certain emergency assistance programs exclusively serve employed individuals. While that's true for many of their grants, since their mission focuses on helping working people who are one crisis away from financial collapse, there's an important exception many people miss. Several organizations offer specialized grants for people who are permanently unable to work due to disability, or for those providing full-time care to someone who cannot work. These programs exist because organizations recognize that even the most comprehensive government programs have gaps, and disabled individuals frequently fall through them. The scope is narrow but addresses critical needs. Medically necessary accessibility equipment not covered by Medicare, Medicaid, or private insurance, extraordinarily high utility bills when you rely on medical equipment at home, facing shutoff, and have exhausted all other assistance-essential vehicle repairs. If you need the car for medical appointments, your doctor has cleared you to drive, and no alternative transportation exists, these aren't flexible grants. They can't pay rent, regular utilities, or expenses not directly tied to health and safety. Maximum grants typically cap around $750 to $1,000. But for the right situation, this assistance is genuinely life-saving. The system is designed intelligently. When you apply through the organization's website, if your responses indicate you don't meet standard employment criteria, but you or a household member receives long-term disability benefits like SSDI, The system automatically offers the option to apply for the independent living grant instead. You'll need to provide documentation proving identity, income, and medical necessity, but everything processes through their website. We receive countless questions about wheelchair ramps and home accessibility. If you or someone you love struggles to safely enter or exit your home, specialized programs exist that can help. National initiatives install modular aluminum ramps completely free for people who've exhausted all other options. These ramps typically cost $1,500 to several $1,000s, depending on height, slope, and length requirements. But when these programs can help, they cover the complete cost of the ramp and professional installation. Volunteer crews assemble everything on site, making your home accessible within hours. These programs serve as last resort safety nets. They expect you to pursue all other potential coverage sources first. Insurance, Medicaid, state accessibility programs. Only after documenting denials from every possible source will they step in. They also cannot install ramps at apartments or multi-unit housing because the structure requires a stable, permanent exterior foundation. One admirable aspect of these programs is ramp reusability. Because they use modular aluminum systems, when you no longer need your ramp, the team returns, disassembles it, and installs it at another person's home. This sustainable approach helps more families access exactly what they need. Having personally assisted someone in connecting with a ramp installation program, I can tell you that you don't fully appreciate how transformative this simple modification is until you've needed one yourself. To apply, visit the program's website and look for Apply for a Ramp or similar application links. Most applications are brief, around 10 to 15 questions, and fairly quick to complete. National home repair organizations operate programs that provide free safety and accessibility modifications for people with mobility challenges or disabilities. What they install: grab bars in bathrooms and hallways, secure handrails on stairs, doorway, widening or adjustments, improved lighting throughout the home, small ramps for single steps, raised toilet seats, non-slip flooring, other fall prevention measures. If you're aging in place or living in a home that no longer meets your physical needs, these modifications can be genuinely life-saving. Find your local affiliate of the organization by visiting their website, using the Affiliate Finder tool, and entering your zip code. Your local office will appear with contact information. Each affiliate maintains its own application process, typically with a form directly on their website. After you apply and they determine eligibility, they'll schedule a home visit to assess what modifications you need and develop an implementation plan. Several national organizations offer funds specifically for assistive technology, typically covering up to $1,000 per person. This assistance helps with wheelchairs and specialized mobility devices, communication devices and speech-generating equipment, hearing aids and assistive listening devices, environmental controls for home automation, vehicle or home lift systems, specialized computer equipment and software, adaptive tools for daily living. Apply through local affiliates of these organizations, visit their national website, locate the resources or affiliate finder page, and complete their contact form to have someone reach out about your specific needs. Every state operates an assistive technology program offering device loans, device reuse programs, and sometimes small grants or low-cost financing options. They maintain lending libraries of expensive equipment you can borrow at no cost to try before committing to a purchase. They also offer donated or refurbished devices for minimal cost or free. Some people save hundreds or thousands of dollars through these programs. Every state calls their program something slightly different, often a T program or assistive technology project, but each state definitely has one. Search for assistive technology program plus your state name or check comprehensive resource directories. Once you locate your state's program website, you'll find information about available services, how to borrow equipment, and how to access their reuse and grant programs. If you or someone you love is currently in active cancer treatment, first, please accept my heartfelt sympathy. Cancer is devastating, and watching loved ones battle this disease is extraordinarily difficult. I also want you to know that specialized hardship funds exist specifically to help with essential expenses during treatment. The support available, the amount of assistance depends on cancer type and individual circumstances. Multiple organizations offer support. Some breast cancer foundations provide up to $3,000. Other breast cancer organizations offer approximately $1,500. Numerous smaller organizations provide $500 to $1,500 to cover rent, utilities, car payments, and basic living costs during treatment, and that's just for one cancer type. Similar funds exist for many other cancers. We're continuously expanding our database of cancer specific financial assistance programs. If you're facing a cancer diagnosis and struggling financially, investigate disease specific organizations and patient advocacy groups, as many maintain emergency assistance funds. This may be the most impactful resource in this entire guide, particularly for those managing chronic illnesses requiring expensive medications or engaged in exhausting battles with insurance companies. Multiple foundations operate disease-specific patient assistance funds. These aren't small programs offering token assistance. They provide substantial, ongoing financial support for medication costs, copays, insurance premiums, and treatment-related expenses. A fund for hemophilia patients provides up to $12,200 annually for medication costs. A fund for Cushing disease or syndrome offers up to $11,600 yearly for copays and medications. Some funds provide over $18,000 annually in assistance. These examples are meaningful to me personally because I know people living with these conditions. But funds exist for dozens of different diseases and conditions. This isn't minor help. This is substantial, potentially life-transforming assistance. If you're paying hundreds or thousands monthly for medications, copays, insurance premiums, or treatment costs, this kind of support can fundamentally change your circumstances. Many of these programs offer a bonus benefit. Once approved for a copay or insurance premium grant for your specific condition, you can often qualify for additional transportation assistance. For instance, some foundations provide transportation grants as $500 prepaid Visa debit cards usable for gas, parking, public transportation, taxis, ride shares, lodging, or even airfare to reach appointments. Step 1. Identify funds that cover your specific condition. Major patient assistance foundations include PAN Foundation, Rare Disease Organizations Treatment, Access Foundations, disease-specific advocacy groups. Step 2. Search for your diagnosis among their disease-specific funds. Most major foundations maintain dozens of separate funds. Step 3. Verify your diagnosis qualifies and check whether the fund is currently accepting applications. Some funds have waiting lists during high demand periods. Step 4. Complete the application. You'll need medical diagnosis documentation, current medication list and prescriptions, insurance information, household income verification, documentation of out-of-pocket medical costs. Yes, it's somewhat tedious, but if you meet the criteria and the fund is open, you could receive thousands of dollars in annual assistance. Fund availability fluctuates based on demand and donations. Some funds may be on waiting list status while others are actively enrolling. Timing genuinely matters. Apply as soon as possible, even if it means joining a waiting list. The potential assistance, sometimes exceeding $15,000 annually, makes the effort absolutely worthwhile. I want you to know I understand what it means to juggle bills and skip medication doses because you can't afford them. I live with an autoimmune disorder. I have a chronic condition requiring expensive medication. I've been in situations where I went without treatment for extended periods, and it was genuinely agonizing. We continuously research resources like these because we know the real-world difference they make. We want to help you find the support you deserve. Thank you for staying with me through this comprehensive guide. I hope you've discovered at least one resource that could genuinely help your situation. If nothing here quite fits your needs, please explore additional resources about low-income emergency grants, state-specific hardship assistance, disease-specific financial support programs, housing and utility assistance, food security programs. We want to hear from you. If you're comfortable sharing, please let us know what state or region you're in, This helps us focus geographically relevant research. What type of assistance would be most beneficial to you right now? What specific challenges you're facing that we might be able to research? Your input directly shapes our ongoing research efforts. We're here because we want to help real people navigate real challenges. Every comment matters and helps us understand where to focus next. Remember, you deserve support. These programs exist because caring people and organizations recognize that everyone needs help sometimes. Don't let past disappointments prevent you from applying when you genuinely need assistance. Stay strong, stay persistent, and know that resources exist. Sometimes you just need to know where to look.